Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off this case because we have quite a few patients who come in with very similar situations, and it can be very confusing to know what's right, what should I do, what are the options, and so this is a really great case. So this is Jordyn. This is Jordyn when she was 9 years old, and she came to us with a referral. Because she's missing one of her front teeth, and not her two front teeth. She has her two adult front teeth in at this point. But in terms of the next two teeth, the lateral incisors on top, she has one on her right side, and she's missing the lateral incisor on the left side. And you'll see that in just a little bit. But I think they were looking for some guidance about what to do. So she was also looking for a nicer smile, and you can see this is a forced smile. Jordyn was not really excited about her smile at this point at 9 years old. And so I think they were very open to doing something to help improve her smile. So here's a close-up of the teeth. You can kind of see the big gap between the two front teeth. These are baby teeth next door to the two front ones. The two front ones are flared out a little bit. And so again, they were looking for some, a little bit better aesthetic solution. When I looked at this, I saw a really narrow upper arch. And so, I thought, hey, one of the first things we can do to make this look better is to use a palate expander and to increase the size of the upper arch in a side-to-side way. And then we can bring the two front teeth together and make them look good for the time being. Of course, we discussed options about what to do with her teeth, and we'll cover that in just a moment. So here's Jordyn at the end of treatment. You can see kind of a bit of a wider smile. Two front teeth are together. Here is the permanent tooth that's coming in on her right side. It is a small tooth. It is not a normal sized tooth. It's a small tooth. And she's, of course, missing the one on the left side. So a lot of times when folks are missing one of these lateral incisors, the gene for that missing tooth can also cause teeth to be small. So that's why this is not an uncommon situation for her to be missing her left lateral upper incisor, but to have the right side one, but for it to be small and kind of misshapen. We discussed the options with the family at this point, and the family decided that we would plan on taking out this adult tooth, the one on the right side, so that she would effectively be missing both of the lateral incisors. And our plan was to let the canine teeth come into those spaces, and then to make everything look good from there. And I like that plan a lot for Jordyn because Jordyn has a large overbite. I didn't really show that to you guys, but she has a large overbite. And so when you're missing teeth and you have a large overbite, it's a great situation for just closing up the spaces and pretending like you weren't missing teeth. So here's Jordyn at the end of our phase one. Again, the two front teeth are together. She's smiling a lot bigger. And she does have a bigger smile because of the palate expander that we used to make the upper jaw bigger. So not only did we give her a bigger upper jaw and therefore a larger smile, but she's also more confident in it at the end of this treatment. And so that's one of the great things about Jordyn's treatment. Here's a little explanation about kind of what's what. And so I know most people are not familiar with looking at these x-rays. So if I could just guide you, here is our tooth that exists, the permanent tooth that exists on the right side, missing that tooth on the left side. And then we have the two canine teeth. So just to show that to you visually, the blue arrows show the permanent canine teeth. These are normally the teeth in the third positions. We are going to take out the tooth that I've outlined in red, her one small permanent lateral incisor, and we're going to let these canines be the next two teeth eventually. So as we fast forward through the x-rays, this is her at the end of her phase one. She's had the permanent tooth now extracted. So we have a little extra gap over there on the upper right-hand side, and the upper left canine has come in to where it belongs. Behind that upper left canine is actually her baby canine tooth, which is still in there. And so we're going to have to take that baby canine tooth out eventually to close space. So again, these two blue arrows are the upper canine teeth, and they're going to now reside at the second positions where she's effectively missing the two lateral incisors. And I say that missing because, of course, we took one of them out. She actually did naturally have one of them. It was just a small tooth. So here we are in braces. You can see that the baby canine tooth has been taken out. So we've got braces on everything. We've got the two central incisors. They're not perfectly straight yet. We've got the two canine teeth next door to them, and we're getting everything in good order. So here's us at the finish. I just wanted to show that just to say, hey, look, there are no spaces, right? We are missing two teeth, but there are no spaces. everything is all closed up. Here's Jordyn at the end of treatment. Again, we have the 2 central incisors, and then we've got 2 canine teeth in those positions next door. This doesn't mean a whole lot to a lot of you guys. Here's Jordyn smiling at the end of her treatment. This is kind of a forced smile. We're taking the picture for record purposes, just to note it. But hey, look, would you know that she's missing her 2 lateral incisors here? I don't think most people are going to realize that she's missing 2 teeth in the front of her mouth. Most people won't realize that it's her central incisors and then her canines. And so I think we've done her a great service. And when we see Jordyn smiling naturally, as we are here, yes, we're twinning, not intentionally, but this is such a great natural smile. And I love this smile. I love seeing Jordyn smile confidently now, whole lot different. She's 13 now, and, a whole lot different than when she was 9 years old. And that's because the confidence that we've given her in her smile. And that's just, one of the best things about being an orthodontist is giving somebody the confidence to smile big and to be who they are. I mean, Jordyn's an awesome girl, and I hope she's just a little bit more confident in who she is now because of her beautiful smile. So anyway, if you or somebody that you love is missing a lateral incisor, because again, it's a common tooth to be missing, and or if you have another lateral incisor that is small, hey, Jordyn is a great example of what is possible. So sometimes we take out that one permanent tooth so that we're effectively missing them both. It's nice and symmetric, and then we can make everything look good as we did here with Jordyn. So let me know if you have any questions about that. Thanks so much for listening. Take care.